This presentation is brought to you by BrainCore Therapy. ADD treatment has traditionally been limited to medication and therapy, whether used individually or in conjunction. These are short-term solutions and better treatment options are available. Though diagnosing attention deficit disorder has become increasingly common over the years, remarkably, conventional ADD treatment has remained very much the same. Typically, doctors will prescribe a daily medication and recommend one or more types of therapy and skills training. While the disease is not curable, the goal of these various treatment methods is to subdue the symptoms of ADD to a level at which they are manageable. Medication has been a bit of a hot-button issue since the disorder first began being diagnosed. Stimulants taken orally every day are the most common form of ADD treatment. There are also non-stimulant ADD treatments such as antidepressants, which some doctors would rather prescribe, especially to children. No matter which route you go, the glaring problems with medications linger. There is conflicting research as to whether it actually helps over the long term. There are bound to be side effects, especially with the developing brain and the body of a child at stake. Some of these side effects include insomnia, stunting growth, trembling, and they're just not acceptable to most parents. As far as therapy and behavioral modification, here are a few of the techniques utilized in ADD treatment. Psychotherapy or psychosocial therapy, cognitive behavioral therapy, behavioral modification, social skills training, and guided educational programs. These therapy methods, especially when used in combination with a prescription medication, can be effective as an ADD treatment. What they all have in common, however, is they are costly, time-intensive, and have no definitive end in sight. Luckily for us, some exciting alternatives to the above options are now starting to emerge. ADD treatment has advanced greatly, as has the rest of medical science. There are treatments today that are designed to address ADD at the root of the problem, quelling symptoms not only in the right now, but potentially for the long term. One of these treatments is called neurofeedback, and it accomplishes this goal by teaching the brain to regulate itself and normalize the brainwave patterns that cause disorders such as ADD. This treatment is drug-free, non-invasive, and completely painless. It utilizes your body's own innate urge to function properly and simply acts as a catalyst. Prior to beginning neurofeedback, doctors will perform a comprehensive analysis of your brain by locating and identifying brainwave patterns that have become dysfunctional. After this, using a series of visual stimuli and sensors, patients will be taken through a series of guided brain exercises in which doctors will retrain your brain to self-regulate. Sounds too good to be true? Rest assured, the efficacy of neurofeedback, especially as a form of ADD treatment, has already been backed up by scientific research. Beyond this, the potential upside of setting yourself or your children up for a life without constant medication and treatment is simply too much to ignore. Embrace the future of ADD treatment with BrainCore's incredible new neurofeedback therapy. Schedule a consultation with a BrainCore clinic near you. For more information, please visit our website at www.braincoretherapy.com.